I want to welcome everyone to the EPA Environmental Justice webinar series for federally recognized tribes and indigenous peoples. This is the 7th webinar that we are holding as part of this series. And within this particular large series, we have mini series. This is the second part of a two-part series on wildfires and air quality. Today's webinar will focus on smoke sense and smoke ready communities, two different programs or activities that we're going to cover today. We are recording this webinar. I just want to make you all aware of that. And I'm going to go ahead now and introduce our speakers. We have three individuals who will be covering the information that I just mentioned is the focus of this webinar. We have Chris Ray, who is the Air Quality Program Manager with the Confederated Tribes of the Colville Reservation. We have Anna Rappold, who is a statistician with the Office of Research and Development at the US EPA. And we have Mary Claire Haino, Environmental Health Social Scientist, Office of Research and Development, also with the US Environmental Protection Agency. So without further ado, I'm going to go ahead and turn it over to Chris.
Yeah, thank you everybody for joining this webinar. I'll be talking about smoke ready and preparing for the next smoke event and actions to protect our community's health, because we're getting lots of smoke and we just need to be aware of the health effects on us. I work for the Confederated Tribes of the Colville Reservation. We're in north central Washington state. The reservation is 1.4 million acres, which is pretty large for our area, and it's really diverse. 3/4 of that area is forested, the rest is shrub steppe, and so we tend to burn sometimes more than others. Last year it was around 200,000 acres, and the year before that it was about 30,000 acres. So it varies with the fire season. So I believe the wildfire smoke is the most important air quality issue that we face. Just because we're getting so much of it and at such high concentrations. So that's very important to understand for people to mitigate for our health issues. So we didn't know smoke will happen, so why not plan for it? And that's part of what Smoke Ready is planning for smoke events all year round. These are pictures from various years from across the reservation and different fires. The picture on the bottom left is from last summer. It was taken by a friend of mine, a homeowner on the reservation, who looked back over his shoulder as they were driving out of the housing unit where they were and saw the fire coming down to burn up his house. So I started out looking at timing of emissions within our area, and wildfires, of course, we can have from June to October. Mostly now it's August, September into October, and sometimes into November, but not very often. But industry goes pretty much all year round if you have problems with industry in the area. But as you can see on this, most of our non-wildfire smoke occurs during the fall and into early springtime, October through April. We have wood stove used to heat our homes. People are disposing of the wood debris in their backyards. And we have agricultural fires, mostly in the form of orchards in our area. And then since we're surrounded in the valley by forests, we have a lot of prescribed fires up in the higher altitudes that may or may not affect us during the year. And the break in that is because there's too much snow on the ground in order to have a prescribed fire. So we have data shown here from 9 wildfire seasons, and it's the percent of time the air quality was in each of the categories of the air quality index. And so the OMAC monitor is on the west side of the reservation. Twist Winthrop, or within Okanogan County, the other monitors run by the state in our area. So we'll focus on the OMAC monitor. As you can see there, about half of the years we have wildfire smoke. This is pretty extreme. It's 3 of those are over 20% of the year, which is over 73 days, I believe it is, of smoke in the moderate to hazardous categories. And so that can really take an effect on our health and how we live our lives. And so it's nice to be aware of when you get your smoke and how much smoke you actually are getting. So smoke ready, I've done a lot of talking about smoke ready, and it's learn something new every time. But smoke ready is community based. Not all communities are the same, and a community can be defined as a reservation, a town, your neighborhood, or even your household could be part of your community. So depending on how you define community, or all of those communities, you can participate in becoming smoke ready. And smoke ready also means all sources of smoke, not just wildfire smoke. We have wood stove smoke, backyard burning smoke, industry, and debris burning. So all sources of smoke all year round, because our exposure is all year round. And it's kind of a lifetime exposure too, if we could keep track of that. Because we want to prevent health problems, and we want to keep people from going to the hospital because of smoke-related problems. And so to do that as a program, and we do a lot of education outreach that we provide people to make them aware of smoke, aware of the smoke-related health problems, and also what kind of mitigation actions they can take in order to lower their yearly and lifetime smoke exposures. And the only way we can actually do that is working with partners. We work with partners throughout the reservation and throughout the counties to implement these education outreach programs. So I start out the year preparing for smoke before it happens. My smoke year is divided into 3 sections. So I'll start with the pre-smoke event planning. I always focus on communications because it's important during stressful times, especially if you have local fires and everybody's running around trying to get a handle on that, and their smoke is really bad. And communications is always the first task that gets dropped in stressful situations because it's the easiest one to drop, but it's also the most important one. So if you establish your lines of communications before the smoke event or fire, and you know the people you're going to interact with, you'll have increased effectiveness. And that's very important in order to get things done faster, and so you can move on to the next task. But in our area, we've experienced a lot of infrastructure issues that affect our communications ability. Big fires take out electric system. You burn up 500 wooden power poles in 2 or 3 hours, and you have problems. That also affects the cell towers. So sometimes no electricity, no cell tower, and then the internet goes out. We've even had smoke so bad that satellite internet is not working. So communications is a big part of planning for the next fire event. I have a monitoring network and a sensor network that I try to maintain to make sure they're functioning, so I can get that data that I showed you before. Some other data that I gather, I put together an indoor sampling toolkit so I can go around to buildings, facilities, and businesses and help them understand their smoke intrusion into their buildings. And I measure the PM 2.5, carbon monoxide, carbon dioxide, and I provide them some literature and some guidance on how to manage their buildings at the same time. We also put out a lot of information during smoke events, so we update all our templates and get prepared for the next season. We get together all our brochures and all our fact sheets and get those ready to go, online and printed versions. A lot of times when you get a lot of smoke in your area or you have a local fire, you have an air resource advisor. So I put together a nice fact sheet for them, and I update that to make sure everything's current before the fire season. That just provides air resource advisor information about the local area, and it's really helpful, and it's part of that communications that is really important. So during the wildfire smoke, as I mentioned, I go into buildings and measure some of the air smoke intrusions into those buildings. And this data is from 2015, when we had a really big wildfire really close to our main government buildings. And so I walked into my building at 6 o'clock in the morning, and it was 405 micrograms per cubic meter inside the building, no doors open, air conditioned shut, all the windows shut. So there's obviously smoke intrusion into all that. So it's really important to understand that. So that's one of the things I do during long smoke events, is try to make people aware of their indoor environments also. We provide a visual guide to the air quality index, mainly because communications goes out, and we have people all over the reservation that may or may not have internet, and they just want an easy way to tell what their air quality is at that time, and visually they can do that very easily. And of course, we promote the Smoke Sense app, and it's been very successful in our area, and kind of popular for the last couple of years, especially when we do have smoke in the area. And we'd like to do a lot of documentation and recording of what we see during the smoke events and fire events, because we want to know, learn from that and tell our story later, which I'll talk about. So we take a lot of pictures and keep a lot of documents. During smoke events, we give out a lot of masks, N95 masks, with our partners. Each person that gets a mask has an opportunity to get a instruction sheet that we put together on how to use them properly. And we distribute these across the reservation, and we also partner with some of the local communities on and off the reservation to do that. Some of the obstacles we've found with mask is messaging if people shouldn't wear a mask, or trying to get by the belief that people with beards, men with beards, should not wear a mask. Even though they're not 100% effective with a beard, they are definitely better than no mask when you're hitting 1,000 micrograms per cubic meter during the daytime and you have to be outside. So we also put together a guide for managing buildings, because we have found that a lot of people didn't think about which door to use to minimize smoke intrusion into their buildings, how to manage their air conditioning units, how to set up air cleaners or clean rooms in their offices or homes, and just generally being aware that there's smoke in our buildings. Usually before the smoke season starts, I also email all the superintendents and education facilities around the outdoor activities guides for schools. It gives them recommendations for shutdowns and how that works. Washington State Department of Health recently put that a new version of that out that's very useful if you can get a hold of that. One of the main things we promote is use of filters in our lives, and that's a N95 mask is one of those filters. Also, the manufactured air cleaners that you can put in a room, they're good for 120 square feet, 140 square feet. They come in various sizes and shapes and filter configurations and prices. The price usually goes up for the bigger room sizes. When you're buying those, look for the replacement filter price, because that may sway your decisions. Also, the boxes now come usually saying that they're approved as non-ozone generators by California. And so that's important to make sure there's no ionization function on there and they don't produce ozone in your small space, which is also detrimental to your health. And you may need multiples of these for your house in order if you want to do the whole house, or just one if you want to set up a cleaner room in your house. We've also promoted the use of the box fan furnace filter configurations, and we put out a video, and in the references we have that link to that. Because they're fairly inexpensive, they're easy to construct, they work really effectively, but there is a noise level involved with that. This picture shows a box fan with 2 air furnace filters hooked on the back, and that does about twice the amount of air as the one filter, and it's easier on the box fan. Recently, a manufacturer came up with a box fan made to put a furnace filter on, and that's really exciting to see that, and that will make these, it's made for purpose, and that's always better than do-it-yourself. But along with filtering your indoor air, smoke season, wildfire season always is the hottest part of the year. So we usually get smoke in our area, and it might be 105 degrees outside, and smoke will last all day long and all through the night. So you can't manage windows and shades to cool your house at night, and then shut your house up during the day for temperature, because there's just too much smoke. So we like the use of in-room air conditioners, like shown there in the picture, where it vents outside the hot air produced by the air conditioning unit, if you don't already have an air conditioner in your house. And a lot of people just don't have that capabilities in our area at this time. You also want to, if you do have an air conditioner, like a window operated model, make sure it's set on recirculation, and you're managing it correctly, and you know where the air is coming from. A lot of people aren't aware that your vehicle's cabin, the inside where you sit and drive, has a filter, and it's connected through your heater and air conditioning unit. So you want to make sure before smoke season that you've looked at that, checked it, make sure you put a new one in there if we're expecting a lot of smoke, which we should be expecting a lot of smoke. And so when you're in your car and you're running your air conditioning and it's smoky outside, always use the recirculation option. And you get 75% reduction of the smoke in your car in about 15 minutes, which is quite a long time. So you have to be a long drive for that. You get less reduction when you're driving because you're forcing air into your vehicle, and then just follow the manufacturer's recommendations for replacing that filter. And then when we're having smoke, you have a hard time making decisions sometimes, because what we breathe does matter, because you have high PM 2.5 commonly into 400 to 500 micrograms per cubic meter, which is hazardous. You may have elevated carbon monoxide, carbon dioxide levels, and your ozone concentrations may be higher depending on where you are in relationship to that fire. The picture of the monitoring tape there shows that when the concentration was about 1,000 micrograms per cubic meter, and the monitor shut down because the vacuum pump couldn't pull air through that tape in order to measure it in about 20 minutes. So you also get a lot of stress and fatigue especially when you have local fires and you have some fire responsibility, you're working long hours, you have a bad diet, lots of donuts involved there, or you're preparing to evacuate, you're helping somebody evacuate, or you're evacuating in local conditions. So all those factors make it so you have a hard time deciding and making decisions safely. So just be aware of that does affect how you behave. So after the smoke, I also recommend people clean their buildings and homes, because there's a lot of residuals and odors in there. Your walls and your carpeting and your clothing all have a smoky feel, and they smell smoky. I've had to do all that inside my house when we've had smoke problems because I didn't have an air conditioner. And so we laundered all the clothes, washed everything we could, washed off the outside of the house just to get all the smoke out of it. And then a lot of people use candles and air fresheners, and that just masks the smoke. So cleaning is really the way to do that. And of course, if you have an air conditioning unit, you really do want to change those filters out. You can use the activated charcoal filter to help take some of the smell out of the air. And if it's really bad, you might consider cleaning your ductwork. So after the smoke event, I also collect all my stories and information and talk to people and find out what they've learned from that smoke event. Because I've found that every smoke event and every wildfire season is different. There's lessons to learn from every episode, and how you need to get that information in order to be able to readjust for the next fires. So I always look at new science, because science is coming out quite often nowadays on wildfire smoke. It's become a very good subject matter for investigations. And then of course I look at my monitoring data to see how the previous smoke season compared to other seasons, and what I can learn from that. But wildfire smoke is not the only smoke problem that we have. We have wood stoves. 50% of our households in our area use wood as our main heating source, and the chart shows that monthly averages can be into the moderate zone for the AQI for the entire month, quite often. And so you have to be aware that, that is part of your smoke exposure during the year. But you can take some actions to minimize your exposure by having a stove buyback, taking stoves out of the market and recycling them. A wood stove changeout program, replacing uncertified wood stoves with certified wood stoves, and that lowers your emissions significantly. We promote burning dry wood, and we provide a lot of education and outreach to people. Also, residential vegetation backyard burning is a big factor during the winter and fall and spring. And so we're also promoting alternatives to that by composting, chipping, mulching, or just taking the material to the landfill. It's very important. And the chart kind of shows you the winter months of OMAC monitor again, and the percent of time the air quality was in each category, and the hour of the day at the bottom. And so you can see pretty much when people start heating their homes and when people get up in the morning and go to work. Also, some of those higher concentrations are affected by the backyard burning. So some of the recommendations that I would provide people is to work with EPA on the wildfire smoke ready site content and the SmokeSense app. Those are very important tools for us. I work with all our other federal partners such as FEMA, I guess Red Cross is in there, HUD, some of those departments to look at smoke issues that they can help us with, and promote awareness that smoke from all sources can affect our health, highlight the impacts of long-term consequences of smoke exposure. Our smoke events are lasting up to 2-3 weeks into the unhealthy to hazardous categories. And so that's a long-term impact where everybody's going to have consequences for many months after those events. And climate change is an important contributor to our big fires in our area because we're having wind-driven fires. That is climate change, results from climate change. So, and also we want to look at our, consider our homes and businesses for smoke intrusion and figure out ways to evaluate those. I found a good guide for evaluating our buildings for smoke intrusion. And I'd like to add a new category to the air quality index called catastrophic at about 500 micrograms per cubic meter because of the consequences of those high concentrations, which we never saw 20 years ago, but we are seeing now. So thank you for letting me speak and listening. And I think this is an important subject, as well as a lot of other people do too. And so I'm looking forward to the conversation, and I've provided a few references for you that you'll be getting when you get the slide deck. So thank you very much.
Thank you, Chris. Hi, everyone. I am Anna Rappold, and I'm a statistician and a branch chief of clinical research with the Office of Research and Development. Now I'm going to share with you some of our experiences and what we have learned during the SmokeSense project. And then after me, Mary Claire will talk about Smoke Ready Communities project. But before we go into the presentation, I just want to say thank you for your attention and all the contribution that you have made if you participated in one of these projects already. But also to thank our team members. We have many team members, Mary Claire included, Steve Prince, Linda Way, and many others who make SmokeSense and Smoke Ready Communities possible. Let me just orient myself. I'm going to turn off my camera for the size of the file and like less distraction for myself. So as Chris has talked about, right, we have changes in fire seasons, and one of the main components of smoke is fine particulate matter, which has been causally associated with a range of adverse health outcomes. This is actually kind of the bulk of my own research prior to getting engaged with wildfire research, as well as many of our colleagues at EPA. We study the effect of particulate matter, PM for short, on health. But we started our research with wildfire smoke about 10 years ago, and it has really evolved from studying the health effects to thinking what can we do about reducing health outcomes and improving kind of the public health outcomes in the communities. We've noticed that in response to the intrusion of smoke into our communities, both individuals and organizations are responding largely through health risk communication campaigns, type of what Chris Ray has just shared with us. And when you think about wildfire smoke, it's like a big, complicated puzzle with many pieces. And we know that communication is an important part, particularly on that health effects study, because most people don't, because it's a health hazard, but it's also that people don't have often a lot of experiences with smoke. This kind of health risk communication has a well-developed history, and the theory and conventional practice related to public health risk communication suggests that both the content and the context of the messaging plays an important role in the effectiveness of that messaging to elicit desired behaviors. And different context may require different content. In other words, what the messaging says is important, of course, but it's also important to understand social and environmental circumstances or conditions in which the messaging is communicated. So if we think about analogy in our family conversations, for example, in my own family, I don't talk to all my children the same way because they respond to different content of the same message. And I also don't bring up certain topics when the context is not right, because my message will not be interpreted the right way. And that works at all kinds of levels, right, of communication. And wildfire and public health is no different. So central to understanding the context are the people who are the intended audience for this messaging, including their lived experiences and perspectives on the issue. But the challenge with wildfire smoke is that, this intended audience can be pretty wide-ranging, and they could have a multitude of different experiences. They certainly include multiple communities, multiple regions, and multiple states that share different background and history with the issue. So the question arises, given these challenges, how do we do this critical health risk communication in a way that makes sense and is useful to the intended audiences and integrates the wealth of guidance from field of health risk communication to make the health risk communication more effective, right? During smoke, we have a lot of we have desire to and the need to integrate highly complex information into a single message. So it's a very difficult job to do when you're first time experiencing smoke. Unfortunately, when you experience smoke over time, like Chris Ray and his community has experienced, the communities become organized and prepare smoke-ready plans and so forth. But first time around is really difficult. So my presentation is about SmokeSense, which is just one small piece of that big puzzle about health risk communication. And it's a citizen science project that aims to better understand the context in which SmokeSense participants may be receiving and interpreting health risk communication. The objective with SmokeSense, we aim to be part of the conversation that reduces health effects in the communities, right? Through participation in the project, we aim to address the gap between the recommended actions and the observed public health outcomes. Understand where is that gap, how can we shrink that gap, increase issue engagement, and inform ways to improve effectiveness of health risk communication, particularly on app-based platforms. The method for SMOC that SmokeSense is founded on is primarily on the use of mobile app, but there's also a number of other projects that have evolved around SmokeSense that supports this overall objective. And before I go any further, I just want to show you a little bit of a timeline of how this project has evolved, because certainly this is something that we previously didn't have experience with, and it was our first attempt. But we first launched the study in 2017, and Chris Ray and his community have been one of our main pilot community, from which we received a lot of feedback. And we used that concept in following years, where we run, we go through the smoke season. Every year it's in different part of the country, kind of like sometimes it's up north, sometimes it's in California. At the end of the season, we look at the data, we look at the input from our stakeholders in the communities and users. Then we revise, we strategize a little bit for the next season, and then we redeploy the app. And we follow this pattern from year to year. And now the new SmokeSense app will be released probably in June 2021. Let me just actually go to this slide, and then I'll go back to the other slide. The participation in the project takes several forms. The users can explore air quality, current and future air quality, the status of fires, the status of smoke plumes. They can receive health risk messaging, ways or how to recommended actions on how to reduce smoke exposure. But they can also engage on a more deeper level, where they engage with the learning modules, and by reporting their observations and contributing kind of to knowledge base. They report observations about the smoke, about the health symptoms, as well as the actions they have taken. In this slide, you can see a few screenshots. The first slide is the main dashboard, which is divided into 3 sections. The top is the AQI. If you press anywhere on that AQI portion of the dashboard, you will see a pop-up window that you can actually see in the second image, with the explanation of air quality index and explanation who is at risk and what actions should be taken. Then the middle of the dashboard contains 4 tiles. One is to report observations. One is provides map with status of the fires, smoke plumes, like you can see in the third image. And then the bottom 2 are the learning modules. And then the third section of the dashboard is the ribbon that you can see in orange at the bottom, where you can learn more about the study, look at the badges you have received, and then you can also see summary of the data that all the users combined have reported. That would be an example of that would be the 4th image on this slide. The important thing is here to note that all the information that's integrated in the app is already available. SmokeSense just puts together these resources in one place and makes them available and accessible to an individual when and where they're experiencing smoke. The ultimate goal is to support engagement and learn how we respond to information and how to improve app-based communication to be effective at improving health outcomes. Okay, now, I apologize for this, but just to mention from individual level participation, all participation is anonymous. Individuals download the app. They're asked to review informed consent. They provide a zip code to anchor their air quality information, and they complete My Profile section. And then that allows them to use the app, which includes, again, Fire and Smoke Near Me section, Air Quality Index section, learning modules, as well as the module that allows you to report your observations. And for different level of interaction with the app, users earn badges. So there's like a user badge, explorer badge, observer badge, and a learner badge. We have a new badge coming up in the new season. Now, I want to kind of skip over a year of events and go straight into what did we learn from our pilot season. Pilot season was run in 2017, late in the season, and very quickly, very much thanks to Chris Ray and his efforts, we managed, but also unfortunately due to wildfires, we managed to get 5,000 participants engaged in reporting. What we learned is that there's a very strong demand for understanding air quality. We also learned that almost all participants had a very good understanding of smoke as an exposure, environmental exposure, and a health risk. And 89% of participants responded taking action to reduce smoke exposure. However, what we did notice is that many participants recognized smoke as a health risk in general, but did not interpret or interpret it to much lower extent as a health risk to themselves. So personal risk. You know, one of those things where you know something is bad, but kind of it's not going to happen to me type of a thing. And some of it is true, right? We know that there's people who are at higher risk, but smoke really can affect every. So relatively speaking, there can be higher risk among certain individuals. For example, if you have asthma, but smoke has an effect on all individuals. And even though health was the reason most participants enrolled in the study or like participated in the study, we did not find evidence that the health status, so how many symptoms do you or what pre-existing conditions you have, did not determine how we respond to smoke. So largely, we learned that we respond to smoke to reduce symptoms rather than to prevent symptoms. And if we think about it, health risk communication, the ultimate goal is to bring about interpretation of the message to induce a person to act to prevent symptoms rather than to be reducing symptoms. When possible, of course, that's not always possible. So in the subsequent, we had a couple of suggestions, insights on what could improve the content of the health risk messages that then be followed up in different research areas. One is to really focus on that personal relevance, on the factors that people identify with, and second, to provide evidence that behavioral change is beneficial. So if HEPA filter, a lot of people, have never used HEPA filter, the evidence that HEPA filter works, specific evidence, does make, we believe, an impact on an individual. But so that was our hypothesis, but we wanted to explore this further. So in the communication, in the next kind of a portion of the research aim, we looked into the perspectives that people have on this issue of wildfire, smoke, and health. Is there a single perspective on the issue? Does everyone agree on it? Or is there a multitude of perspectives. And then we try to relate these perspectives to the existing theories of individual level health behavior change, because that can help us then provide framework on how the content of the messages can be constructed effectively. What we did with this analysis was we used different measures on perspectives, which were determined by response to the questions in the app that relate to personal health, access to exposure-reducing resources, measures of self-efficacy, perceptions of smoke as a health risk, and other questions that all related to kind of what perspectives do you have on the issue. And what we found is that there's about 5 major traits among these perspectives collectively. And then we mapped them, we gave them names. So there is a group was called, on one end of the spectrum, unengaged. They tended to be mostly younger, very physically active. They have a completely low perception of risk, and they're not engaged with the issue. Then on the other side of the spectrum is those who have already decided to act. Those would be, we call them protectors, because all they need is kind of a cue to action, and they know what to do and how to protect themselves. So they just need to know if in the analogy of the weather, that tomorrow it's going to rain, I'm going to bring an umbrella. But in the middle is this where most health risk communication is targeted, is in this group of individuals who are deciding on the issue. And we identified kind of 3 groups of people: cautious, proactive, susceptible. But I'm not going to go in very much detail. The idea is that mapping these traits to the precaution adoption process model helps us understand where are individuals in the decision-making process. And that knowledge can identify messaging, the content of the message that may be perceived as relevant. For example, individuals who may have low self-efficacy for reducing their exposure may not believe that they can do actually something about it. You know, kind of like, well, I know French fries are bad, but what can I do about it? They're here, I'm gonna eat it, right? So the message content that would be beneficial in that context is the messages that really focus that these, certain actions are within the sphere of influence for those individuals, and that there is that the impact will be beneficial of taking action, right? So to summarize, among this sample of individuals, participants in the smoke sense, we identified factors such as health status, risk perception, informational needs, and access to exposure-reducing resources really had an important role in differentiated perspectives on the issue. And these different groups engaged with the app differently. So some groups engaged with the app to deeper level, through learning and through reporting than others. By positioning these perspectives on the precaution adoption process model, we illuminate where each group may be with respect to adopting exposure-reducing health behavior. Of course, we have to understand that there are some limitations because this is a self-reported kind of a self-reported data, so it may not be generalizable to entire population, but participation in Smoke Sense is growing from season to season. Now we have 45,000 users and many of them who report regularly. And also there could be additional factors that we didn't think about as a research group that could inform perspectives, but were not included. Or these factors could also change over time because our wildfire smoke seasons are changing so much over time. And finally, to bring it back home about this study is, as we move forward, we aim to best tailor health risk messaging to each perspective groups, right? We think that that can have an effective, that can be effective into getting us to where we want to be. Some examples we consider are listed in this tables, like, again, there are 5 groups from protector to unengaged, right? Kind of suggesting what health risk messaging should be used based on previous theories that have been explored in other contexts. Now, this is a really complex issue, right? Wildfire smoke and public health is, it's very difficult to understand all the context and put all the information into one single, clear, actionable, and accessible message. That perception of risk for some individuals, most individuals probably, is really tough to access in our consciousness, right? Very few of us think about smoke. What would we do if we were exposed to smoke? But we know that contemplation before something happens really can impact on us doing the right thing when it actually happens. And that's really the crux of what we're trying to study. At the same time that we have this evolving challenges where risk communication platforms are evolving. People get information from so many different sources. So that's also another angle, and that for research. And then to mention that it's really difficult to provide specific evidence of the benefit for behavioral change. We recognize that through some of this research, and we have quite a few studies now. This observation really motivated us to conduct some of the studies that historically we probably would have not have undertaken. And finally, before I turn it over to, I have one more slide, but this one, I do want to say that we took citizen science approach. We didn't have experience with citizen science approach before, but we really think that it's an approach that develops points of entry into contributing to research and engaging with the process and the data for members of the public that is difficult to access otherwise. It's mutually beneficial because it helps EPA answer the questions, but it also allows for public input, and it's beneficial to individuals to access this information, have access to this information. It also allows for two-way communication, as mentioned earlier. Chris Ray, for example, and his community has provided us a lot of feedback in our pilot years that we really try to take. We can't always address all the shortcomings, but every year we really try to strategize on what we can address for the next year and kind of like chip away year by year. And then finally, citizen science is really, an ultimate example of science that fosters change in the communities, right? And embeds that, supports that data and knowledge sharing. Through these last 3 or 4 years, we've also developed quite a bit of side projects that are related to smoke sense in that have taken new interesting directions. And I'm just going to leave it here at that and let Mary Claire then talk about smoke-ready communities.
Hi, everybody. My name is Mary Claire Haino, and I work with Anna on the Smoke Sense project. And I'm going to just share a little bit about the Smoke Ready communities research that we have underway, and try to link this back to some of the Smoke Ready work that that Chris shared at the beginning of the webinar. I'm going to turn off my camera just for bandwidth, and then we'll go from there. So, so Smoke Ready Communities, from a research project, is really designed to better understand how a collaborative, locally led approach to planning for future wildland fire smoke events can help communities improve their response to smoke events, as well as their readiness for future events. And so smoke ready communities as a term, you may hear things like smoke ready communities, all multiple variations, but it really is like a term that reflects this very broad approach across multiple agencies and organizations that are all aimed at doing exactly what Chris suggested, which is getting better prepared for future smoke events, and being able to respond in a way that makes sense and is appropriate based on the community needs and priorities and resources. And so from a research perspective, we're really looking to try to understand what this collaborative approach means in terms of those desired locally defined responses, and how taking a collaborative approach may influence resilience for future events, meaning resilience meaning the ability for a community to bounce back after a smoke event, but also to learn from their experiences during past events and be able to improve their response going forward. And so we've pulled together a range of resources that we think would be useful for local smoke planning teams to use in scoping and developing their a tailored local response plan. And so this research is really geared towards local, state, and tribal organizations that focus on wildland fire and public health and environmental quality, as well as air quality. And so when a few years ago, before we got involved, some of our colleagues in the Office of Air and Radiation within EPA, as well as external partners, started to really try to define and scope what does it mean for a community to become smoke ready. And through a number of interviews and interactions, this list of 6 community characteristics emerged, and they are communities that are ready for smoke events, and that can effectively respond in the way that they define, have gone through and identified their vulnerable populations or subgroups within their overall community that may be at increased risk for adverse health effects related to exposure to smoke. They have information delivery channels, methods already kind of planned and set up, so they know who they're going to get who they want to get the information to, including the overall community population as well as specific subgroups within that community, and they know how they're going to get that information out. And the third characteristic is they have those communication and educational materials prepared and ready to go, such that when they're needed, they can be distributed through those communication channels to the different groups. They also identified a couple of more technical aspects of smoke readiness, and I know during current circumstances, public gatherings and clean air spaces within communities are challenging, but I think into the future, that it will come back around, and so communities that are ready for smoke events have kind of planned through and thought about and made plans for cleaner air spaces that community members could come to, and this is especially important in places like what Chris mentioned, where there's not a need sometimes for each home to have an air conditioning system, just based on climate, and so in those kinds of communities, it can be really important to have places where folks can go to escape from smoke exposure. They also identified air quality monitors and temporary sensors. So this characteristic was all about communities that have planned ahead for how they want to supplement and fill in the existing air quality monitoring network that's within their communities with temporary monitors that can be put up and during, can be set up and then taken down depending on the smoke circumstances. So they've got communities that are ready for future events, have already gone through that process of understanding what their needs are related to that, and then what they want to do in terms of purchasing air quality monitors, figuring out who's going to maintain them and calibrate and set them up, all of that kind of thing. And then the last part was they said that these communities are doing all of these things, but they also have decision points for action, so that they aren't making those decisions in kind of the heat of the moment, if you will, trying to decide okay, now what do we need to do when? That's already been gone through and planned for. So now they're just implementing these plans based on different criteria or trigger points that may emerge during a smoke event. And so one of what we see here and what we've heard and learned from other projects is that communication, like both Anna and Chris were saying, a public health response to wildfire smoke episodes is largely a communication response, and that's kind of reflected in the first, the half of the community characteristics that were identified, and it's largely a communication response because what we need people to do is to take action that related to their personal exposure to wildfire smoke, and not necessarily try to take action or get involved in any kind of response or management. And so we focused, and the public health communication part is central to the Smoke Ready Communities research that we are starting and have underway. And so after our colleagues identified these 6 characteristics, one of the things that we're exploring from a research perspective is the role or relationship that a collaborative approach to planning for future smoke events, the relationship between taking this collaborative approach and increased or improved readiness and response to smoke, as well as increased resilience for future smoke events. And so when I say collaborative approach to response, we have another set of steps that we've outlined, but it's really about pulling, at the local level, pulling together individuals from different organizations and different groups and sectors within the community, and bringing folks to the table to understand what the issue looks like and how it's experienced by different sectors of the population, different subgroups within the population, and then trying to really develop that comprehensive picture of the type of impacts that community members are experiencing, and then leverage that in terms of that understanding and developing a community-specific response plan for that addresses and tries to mitigate some of those adverse impacts. And so, kind of pulling these people together and developing a plan, and then putting that plan into action when following integrating the decision points, so putting that plan into action when it's decided upon, and then monitoring how it goes, and then celebrating all of the work that went into it, and then really kind of thinking, reflecting, and revising on what went well and what didn't go well. And we have the repeat, which we see in a lot of these kinds of models and frameworks, and really to underscore that, like, as dynamic of a situation that smoke is, it really bears the effort for it. Really requires that iterative annual look at the plan to see, okay, this is what we did last year, and this is how it went, and now let's think through how can we do better. So really kind of pulling in that learning and improved future response aspect. And so so what are we actually doing? So where we are right now, we are working with 3 communities in the western part of the United States. And with each community, our research team is working with individual leaders within those communities that have expressed an interest in working with us on the project. And we're working with them to develop a local smoke team that is a smoke planning team that's made up of folks from a range of sectors within the community, and then we'll go through this process with them of education, so getting folks within that team on the same page and using some of the same language, and or maybe not using the same language, but at least understanding what each other means when we use different terms, and then kind of going through that education part. But then the second half of the process is working with the team to develop, okay, so now that we know what the risk is and what the risk is to us, and what our typical response is, let's develop a plan for what we want to happen, and kind of scope out our plan across those different community characteristics that our counterparts identified a few years ago. So including in the plan, going through the process of identifying those vulnerable populations and vulnerable subgroups, and kind of listing those within the plan of these are we want to get with the whole group and the whole community, of course, but there's subgroups in here that may be at increased risk, and these are what the subgroups are and how we're going to connect with them. So really working with that group to get on the same page in terms of awareness, and then also developing a plan for what they would like to do in terms of their response. And from a research perspective, what we're doing and the kinds of data that we're collecting is we're assessing both where those smoke team members are in terms of different individual level capacity for engaging in the planning process. We're also getting their insights on broader dimensions of community capacity for responding to smoke, and we'll be collecting those data from folks at multiple points throughout the process. And we're also observing these public team meetings to really understand what does it look like when a collaborative process is used in this context, and what goes well, what kinds of challenges come up. And what we hope to do with the information is then to be able to share that with our colleagues, and more broadly to share and kind of share the story of this is one approach that you can use at the community level to improve your future response, and here's how it worked in 3 actual communities, and this is what went well, and here's where they would do it differently next time, and really trying to inform some of those recommendations that we want to be able to make for folks for improving smoke readiness. And so we're going through fall of 2022. We're currently underway right now, and we'll go through fall of 2022. And before I wrapped up, I really just wanted to recognize Chris and Chris Ray and his colleagues for his leadership and vision, and that has both benefited his community, but some of these broader research efforts, their work has much broader reach than just within the Colville Reservation, and we've been able to use their insights and experiences to both improve future iterations of Smoke Sense, but as well as the Smoke Ready Communities research effort. So I'll hand it back to you, Danny. Thank you.
Great. Thank you, Mary Claire. And so we're now going to enter into the questions and answer period, as well as talk with you a little bit about our evaluation that we put together for this webinar. So I have two of my colleagues from EPA that will be assisting with both of these. We have Danielle Ridley, who's with ORD, who's a colleague of Mary Claire's and Anna's, who will coordinating our question and answer period. And then I have my colleague from the Office of Environmental Justice, Erica Farrell, who will share with you a little bit about the evaluation before we go into the questions. So if maybe Danielle, Danielle, if you don't just mind waiting for just a minute, let Erica just mention about the evaluation so folks could perhaps be working on that while we do the Q&A.
Good afternoon, everyone. Again, thank you for attending this webinar. And I've posted in the chat the link to the evaluation form, and we will certainly appreciate you completing it. So let us know how we can improve and whether you received any valuable information from this webinar, which is a part 2 on wildfires and air quality, smoke sense, and smoke ready communities. Thank you.
Great, thanks, Erica. And we're also going to be emailing you this evaluation form as well. But like everything in life, if you do it, an evaluation right after the event that you participated in, that's when you have the greatest likelihood of being able to provide some good insight. So if you could do that for us, we'd appreciate it. You just click on the link, fill it out, hit submit, and it's a quick set of questions that are easy to answer. Okay, Danielle, I'm going to turn it over to you to run our question and answer period.
All right. Hello, everyone. My name is Danielle Ridley, as Danny mentioned, and I'm from EPA's Office of Research and Development. And so we've reached our question and answer segment. So we'll address questions as noted in the chat, and we'll allow you to unmute yourself. So please type your question in the chat box or use the raise your hand feature at the top of your screen so that we can make sure we get your question. So currently I see 2 questions in the queue. The first one, it seems to be the case that wildfire season is accelerating each and every year, lasting longer and coming sooner than later, damaging planet Earth and causing millions of people harm, especially on the west coast of the USA. What steps are we taking to mitigate and prevent these wildfires? And I believe this question came during Anna's segment, but if any of the researchers, and Chris, if you have any feedback, please feel free to chime in on this question.
Well, it's a very good question. Our focus, so at EPA, we have the Mary Claire and I work inside of the Office of Research and Development, right? But the question is related to the management of smoke and fires, which would be a question for the programmatic office, such as like Office of Air and Radiation, that deal with that. But just generally from being part of this community of addressing wildfire smoke as a health risk, my observation is that this has been really an example where across all federal agencies, people have been working together to come up with new and better frameworks to manage the risk of fires, right? But largely it depends on the states themselves, and a lot of it, federal lands, of course, are purview of Department of Agriculture. I don't know if that helps, but I just want to say that it is a very big question, and many states have increased the level of prescribed burning and the level of mechanical clearing of the lands, or proposing different use of the lands in order to reduce the risk of fires themselves.
Thank you, Anna. Mary Claire, did you have something to add?
I was just going to add that the regional EPA offices might also have some resources to be able that can, to be able to share with folks that so that we're, that are specific to their particular context. And so, there's so many different factors that go into it that that the regional EPA office is likely someone who can point them in the right direction and maybe give a more informed, not more informed, but more accurate response. And we'd be happy to connect folks if that's helpful.
Great, thank you. The next question in the queue is, does SmokeSense have plans to incorporate the pilot smoke and fire map with additional calibrated personal air monitors?
Yeah, that is very high on our list of things to do. We actually hope that we would be able to do that by this fire season. We explored quite a bit on how to go about doing it, given our constraints, but I think it's doable.
Okay, thank you. And then
as a citizen science project, so we are there. Fire and the fire website already includes, for example, purple air, where we would like to develop a concept where any personal sensor could be included on the map, right? So for that, we need to develop a little bit of an infrastructure and how the sensors communicate with the app, and with our servers in order to render that information back to all the users. And then, how do you show the array of air quality information from different sensors? So it's kind of, we're thinking about it, one specific task versus a larger domain.
Great, thank you, Anna. We have another question. How about USFS temporary monitors deployed for smoke? They're included on the map. They're different. They're given as a different symbol on the map, but I believe that is U.S. Forest Service, and maybe some of our regional resources, EPA's resources, but they worked out so that that data is reported live, and then we can just draw that data from their database. So it is included in the app. Okay, thank you. And so it looks like we're going to make sure we get that link for NTAA for those who are interested in contacting the organization, as Pat Childers mentioned, and as Mary Claire also reiterated, that tribes can work with EPA regions and the NTAA, so the National Tribal Air Association, to address these programmatic concerns and learn best practices from them. So please, we have about another 10 minutes. If you have additional questions, feel free to put them in the chat or raise your hand, and we'll be sure to get your question.
Okay, Danielle, it doesn't appear that there's any other questions in the chat room, and I don't see anyone raising their hands. So we will go ahead and close out the webinar. We want to share with you our contact information. I recognized that I failed to introduce myself at the beginning. So as the saying goes, better late than never. So I'm Danny Gogol with EPA's Office of Environmental Justice. We greatly appreciate you all participating in today's webinar. As I know I mentioned that there have been several already, but I didn't mention that our hope is to have more or less one a month. This month was special. We had two. That's not our normal. So look out for our notices. We publish the information about the webinars on our EJ listserv. If you do not, if you're not registered for on the EJ listserv, we encourage you to do that. You can just Google EJ listserv and you can find that. And basically, it just requires you to send an email to the link that's provided or the email address that's provided, and that gets you on the list. We want to thank Chris from the Colville Reservation, and Anna and Mary Claire, both from the Office of Research and Development, and of course my colleagues, as I mentioned, Danielle coordinating our Q&A session, as well as Erica, who's been doing a lot of the behind the scenes coordination with me on these webinars and many of the logistics with the teams. We are going to, as you all know, we've recorded this session, and it is our intention to actually post this on our webpage. It does take us a few weeks to do that, and once we do, I will do my best to remember to actually email it, the link directly to you. In the event that I fail to do that, you can go to our webpage that was posted in the notice for this webinar and be able to see the recordings that exist. So thank you again for participating. We do ask you to please provide us feedback. We will send out an email shortly, if not today, tomorrow, with the PowerPoint presentations that were used today for this webinar, as well as the evaluation form. So enjoy the rest of your day, and we look forward to have you participate in our future webinars. Take care now.